Today our topic of discussion is between like we were discussing the ICD-10 and ICD-11 differences, and today we will cover the elimination disorders, which is a new category in the ICD-11. Previously, if we see, I was checking it last night. So if we see here, it is, if you go to very bottom, and we will see here, it's F98 somewhere. So let's go to 250. Welcome, Dr. Anwarul Haq, my colleague and consultant psychiatrist in Republic of Ireland, very senior consultant.
Thank you.
So yeah, so it was somewhere in the other disorders. If we go in the ICD 10, and now it is defined is it's in the ICD 11 under elimination disorders. 225 suggested ICD code, and let's go further down to 15 further up. So let's go to 206. So we are into ICD 10, and here we are like F98 category. So in F98 category, it is other emotional and behavioral disorders with onset usually occurring in childhood. So non-organic anuresis. Now, as we know that organic, non-organic, or functional, these categories are eliminated completely by the ICD-10. They generally say that it is whether it is something it is primary or secondary. So everything functional becomes primary here, and everything organic becomes secondary here. So this was on non-organic anuresis, non-organic encopresis, and feeding disorders of infancy and childhood, pica of infancy and childhood, and stereotype movement disorders, stuttering, cluttering. So everything which were there in other codes, like the 8 codes, have been moved to the have been, like, not everything, but most of the things which were coded as 8 have been given a proper coding in ICD 11. That is one difference. So elimination disorder is the category which is 6C00. So anuresis, and they include the term functional anuresis, psychogenic anuresis, urinary incontinence of non-organic origin, but they're not using these non-organic or functional as the main heading. And then they're excluding the organic causes or physical causes, stress incontinence, urgent continence, etc. So now they say here it was, let's see, that anuresis, I don't know if they were classifying it or not. So non-organic anuresis we are just seeing, but they're not classifying as such. Yeah, here they say nocturnal, diurnal, and nocturnal and diurnal in ICD-10. So in the same way, they are saying it nocturnal, diurnal, and nocturnal diurnal, but they are at least defining it here. At least in the descriptive book they have defined. So we have, in comparison, we have green book, and there were no like the description in the green book. So encopresis, again encopresis with constipation or overflow incontinence. So here we see here there are So chronological, mental, and there is some, some description of non-organic encopresis, but now here they are more descriptive here. Encopresis with constipation or overflow incontinence, without constipation or overflow incontinence, and encopresis unspecified. So the description you can read it in the books. Now the next one, and I spent a long time searching in somatic, the word somatic, and I could not find the word somatic or somatization with S or Z. I could not find it in the whole ICD 11. So when we come to here, control V, and let's put somatization or even somati, and zero results found. So somatization, zero result, and somati, no results. And now if we go with soma, you will find dipsomania, for example, and there are, so it's not a computer's fault. These terms do not exist anymore in the ICD 11. So they have excluded the term somatic and somatization. Even for the depression, they're not saying anything about the somatic syndrome in depression. So, so what term they come up with is bodily distress disorder, which is similar. And another colleague of mine, Dr. Mutahir Gulzar, very senior consultant psychiatrist from the Republic of Ireland, very welcome, sir. So, bodily distress disorder, it's kind of equivalent to somatization disorder now. Uh, so, it may or may not be the same, but it is equivalent because there is no term, and there is a term of hypochondriasis there, but there is no term of bodily distress disorder. So we can read a little bit because it's a common disorder. So bodily distress disorder is characterized by the presence of bodily symptoms that are distressing to the individual and excessive attention directed toward the symptoms. So look here, that that it is the symptoms that are distressing to the individual, and and again, uh, and attention directed toward the symptoms. So in hypochondriasis, what would happen? In hypochondriasis, the attention is paid to the suspected diagnosis. Here the attention is to symptoms, and which may manifest by repeated contact with the healthcare providers, and we saw the same in somatization disorder. If another health condition is causing or contributing to the symptoms, the degree of attention is clearly excessive in relation to its nature and progression. Excessive attention is not alleviated by appropriate clinical examination and investigation and appropriate reassurance. Bodily symptoms, so they go with excessive investigation, but they still say that symptoms are present. Bodily symptoms are present, being present on most day for at least several months. Now that is the catch. Several months is the, that it should be there for several months. And I think if you go to the website, they will give you the diagnostic requirement and diagnostic guideline as well. So it is the icd.who.int, and then go to ICD 11, and they have come up with the guidelines. And even this PDF document is quite recent. It was only released in February last month, and there was an addition of about 20 pages as compared to the May 2021 document. So this is essentially, this is replacing the somatization disorder. And exclusions, Tourette, dissociative, hair plucking, hypochondriasis, they are excluding. Body dysmorphic disorder, they are excluding. So everything they are excluding except the somatization disorder. That means that this is replacing somatization disorder. The next thing is, and now they are classifying it into mild, moderate, and severe. They do the same with the borderline personality or any other personality disorder. They come up with mild, moderate, and severe. And we don't have time to go through, so we are just going through the categories. So when you come up with a patient with somatization disorder, you can diagnose it with the mild or moderate or severe bodily distress disorder. Now the next one, which I've presented already in a full lecture, and then I presented it at my workplace as well, is body integrity dysphoria. Body integrity dysphoria, it is a very interesting disorder in which there is a desire to become amputated and physically disabled. So they are not fine with their walking legs. They want to be on wheelchair. Usually it is legs, but it could be any body organ. They don't want it. So it could be paraplegic, blind, limb amputee, and they have online forums as well. And this is the first time it has come to the international classification, and it hasn't come to the attention of DSM or American classification yet, but ICD and DSM go hand in hand and in keeping with each other, in line with each other. So maybe the DSM 5 will address this in the next edition. Uh, so then we come to the disorders due to substance misuse. So again, it is not much difference to the ICD 10. So it will be the same, except the hazardous alcohol use, I think they might have excluded it. So where it is causing mental disorder, they will including it. So hazardous alcohol use, the category was used in the past to describe alcohol-induced depression. So now if you say hazardous alcohol use, you can only, you have to specify which mental disorder it is causing, because everything is there now in ICD 11. So you can't just say, you can say dependent disorder or alcohol use, but it will not come under mental disorder. So there is a category, but that's a Q category. So you can still say hazardous alcohol use, but it is not, it will not come under a mental disorder unless and until it is causing either dependence or a secondary mental disorder or mental illness. So here, well recognized and included in the definitions of harmful use, i.e. episode of harmful use. I think so hazardous, I don't know why they are excluding it, but they are saying episode of harmful use of alcohol and harmful pattern of use of alcohol. So let's see what, so what they are excluding is hazardous, but not the harmful. So the harmful use of alcohol is still there, but the hazardous category they have excluded. So we start with, in the same way in ICD 10, F10.1 was harmful use. In the same way it is there. Then harmful pattern of use of alcohol, episodes of harmful. So they have included it in episodic and pattern, non-episodic. And then they come as harmful pattern of use of alcohol, continuous. And then they come with the dependence. So dependence, it's the same way, they're the same things in ICD 10, no change up till now, because we are seeing the harmful pattern, not the hazardous, but the harmful, and then alcohol dependence, and then we come to the sustained partial remission. So they are categorizing the remission patterns now. There is a sustained partial remission, sustained full remission, intoxication, withdrawal. So everything is almost the same so far. And Now, alcohol withdrawal can be uncomplicated. It could be complicated with perceptual disturbances with seizures. So it's the same as like delirium tremens, which is now we can say that it is. I mean, it will come as a delirium tremens later, but here we are seeing the perceptual disturbances and seizures. And now it is coming to alcohol induced delirium, so which is more than perceptual disturbances. So, if there is a full delirium syndrome along with usually perceptual disturbances, and then there is a disorientation as well. Alcohol induced psychotic disorder. Previously, this category was not there in ICD 10, but now here it is. I mean, it was there in when they say F1X.2 or 5 X.5 1. So F1X.5 any substance will can give you, but they were not very clear. Now they are saying alcohol induced psychotic disorder clearly with hallucinations. And previously they said alcoholic hallucinosis. And then there was a morbid jealousy, Othello syndrome, which was alcohol related. So all these things have come into the diagnostic of category of alcohol induced psychosis. There can be delusions. So, as we see very commonly, the Othello syndrome or the delusional disorder, commonly with the alcoholics, morbid jealousy, alcohol induced psychotic disorder with mixed psychotic symptoms, and then this is the new category which was long awaited. We had to go to the harmful use each time to uh, to describe the alcohol-induced mood disorder, so harmful use. But now it is a separate category, and we always read that alcohol is a depressant and it causes depression, but it was nowhere classified in the books. So we either have had to take the help of alcohol induced psychotic disorder with predominant mood symptoms, or otherwise we have to go with alcohol induced like alcohol harmful use. As in ICD 10 American edition, there is an American edition of ICD 10 as well, and they included the alcohol induced depression under the harmful use category, because they can't invent the categories in ICD 10, but they had the privilege of including something in those categories. So they included alcohol induced mood disorder in harmful use. But now in ICD 11, it is a separate category. And now we go alcohol induced anxiety disorder, because often patients come who are taking alcohol or cannabis, and they claim that they are having enormous amounts of anxiety, especially panic attacks. So that is the term here now described. Same way, cannabis. So harmful use of cannabis, harmful pattern. Then it could be episodic, or it could be here it is. It could be uh, continuous. Then dependence. Dependence criteria, they are the same: tolerance, withdrawal, and difficulty to control, and persistent, primacy, etc. And so cannabis dependence, sustained partial remission, intoxication, withdrawal, everything same. Delirium, psychotic disorder, very systematic, very easy to learn. And then anxiety disorder. So here, uh, psychotic disorder, and let me see if they have mood disorder or not. Yes, cannabis induced mood disorder is there as well. And now we go to the anxiety disorder, and the new category now after cannabis is the synthetic cannabinoids. When they came to the market, it was early 2000s. So one patient came to me in Ireland, and he said that cannabis was legally sold in such and such place. And I said, no, how can it be possible? So he was actually talking about these synthetic cannabinoids, which were not declared illegal by that time. And they were sold in the name of cannabis in the beginning. So then they acquired the name of head shop products. And in the UK, they are known as legal highs, because in the beginning they were legal. They are illegal everywhere now, but in the beginning they were, so they used to call legal highs. And then what happened was that they found out that they are even more dangerous and more psychotogenic than cannabis, so they declared them illegal. And they used the word of synthetic cannabinoids. So their other kind of names, the street names are spice. If we go to the UK, mostly the word used is spice. And when we in Ireland, it is the bubble is one of the names used for these synthetic cannabinoids. And there are various types, but there is one type of, I can't remember the name now. I think mephedrone. Mephedrone was the, like, there is one methadone and then there is one mephedrone. So mephedrone was one of the types most commonly used, but there are many others. So all these are called synthetic cannabinoids because structurally they may not be cannabis like, but when they bind to the receptors, they bind to the cannabinoid receptors. So again, same things: harmful use, harmful pattern, uh, and episodic, continuous, and dependence, and partial remission, full remission, intoxication, withdrawal, delirium, psychosis, mood disorder, because even these head shop products can give you the panic attacks very commonly, and they have more effect on heart and heart rhythm and QTC prolongation, etc. So anxiety disorder, opioids, it's the same, no difference, except uh, because of the stereotype pattern, they might have included the opioid induced psychosis, which we seldom see, opioid causing psychosis. So here you go. So it's usually we don't see, but they have included it as a category. But we can see everything else. Mood disorder we can see depression with opioids, and sometimes anxiety. Sedatives, hypnotics, anxiolytics, again this very same pattern. And we'll come to a new category after this sedative, hypnotic, and anxiolytic dependence. So, and it is something again synthetic. So let's scroll down, because these things are again the same. And yeah, we are seeing withdrawal, delirium, and again they will say sedative induced psychosis, which is very rare. I don't know if they have included here. Mood disorder is there. Yeah. So sedative, hypnotic, or anxiolytic induced psychotic disorder. So for the sake of completion, they did the same in ICD 10, and for the sake of completion, they have included everything here as well. So disorders due to the use of cocaine, harmful pattern of cocaine, again the same thing, cocaine induced psychosis, delirium, mood disorder, anxiety. And again it is mood disorder. So if you go to the any mood disorder, it's not only depression. So it should describe mania as well. Look here, it is depressive disorder, bipolar disorder, schizoaffective disorder. So it could be anything like depression or mania or bipolar or schizoaffective. So it's a mood disorder, and it's a great improvement in ICD-11 that it is describing these mood disorders, including depression and mania, in secondary to the alcohol or any other substance misuse. Cocaine, stimulants, very similar. So we'll just pass through it. And amphetamines, uh, so stimulants intoxication, methamphetamine, methcathinone. So methcathinone is something which is a true amphetamine, like or a true, not true amphetamine, but a true stimulant, which is a traditional stimulant. So methamphetamine is something else, and methcathinone is something else. So cathinones usually, when we go to Yemen or Somalia, and we have the Somalian doctor. If he was here, I would have asked him to comment more on this. So, but he's not here at the moment. Uh, so, uh, so what? So these cathinones, qat in Arabic, or cat. So cathinone, these come from the qat, that is methcathinone, and that's a stimulant. And again, the same syndromes seen with stimulants, whether they are amphetamines or qat derived. And then we come to stimulant. Let's scroll down. Now, synthetic cathinones. So as they made substances similar to cannabis here, which are called synthetic cannabinoids, they also made very similar substances which are similar to uh, cat or cat. So cat, very similar to cat uh, in their kind of functioning and in their effect to brain, and they are called synthetic cathinones. So bath salt. So synthetic compounds with stimulant properties related to cathinone found in khat plant, Catha edulis. So this is a new addition in the ICD-11, uh, two new compound categories or substance categories: synthetic cannabinoids and synthetic cathinones are uh, are described here now. So, and again, the same pattern: intoxication, withdrawal, delirium, psychosis, mood disorder, and anxiety disorder, and or induced obsessive compulsive or related disorders, impulse control disorder. Again, their same pattern they will say with caffeine, and I'm sure they will come up with a psychosis with caffeine, which will, I don't know if they're describing or not. No, withdrawal, thank God, they're not describing any psychosis with here. So that's the difference. So they're saying intoxication, withdrawal, and then certain specified caffeine-induced mental and behavioral disorders, but and anxiety disorder, of course, but they are not including depression or psychosis, which is which is a good thing that they haven't included, because we are using caffeine every day and no one gets psychosis. So why to describe it as a category? So hallucinogens, again very similar: episodic continuous hallucinogen dependence, intoxication, delirium, psychosis, mood disorder. nicotine again, and let's see what categories they come up with. Harmful dependence is there, dependence is there, and intoxication is there, withdrawal is there, and then there is no mention of psychosis or depression because they don't do. Anxiety, I don't know they have included or not, but I mean, if there is nicotine induced anxiety, I'm sure that can come as in the 6C4AY, other specific disorder due to nicotine. Then volatile inhalants, or which we used to call as solvent abuse. So it is now uh, this inhalant abuse. And welcome to Dr. Wahid, another colleague of mine. So, uh, so we are just seeing volatile inhalant psychotic disorder, etc., etc., and then MDMA, ecstasy. And if you like see most of the ICD-10 or ICD-11, it is taken over by the substance use disorder description. So like when we started, we were on page 63 and we have gone up to page 136 because it's the same thing appearing again and again with the
Good.
like these substances.
Psychiatry.
Okay, and then disorders due to the dissociative drugs, including ketamine and phencyclidine. So similar categories: dissociative drugs, harmful use, harmful pattern, and then dissociative drug dependence, including ketamine or PCP, and drug intoxication, delirium, psychosis, and then other mental or behavioral disorders. Now, note down here that they have not included depression because ketamine in itself is a treatment for depression, so it's very unlikely to cause depression. And mood disorder, yes, it is. But usually, if it causes any depression, mood disorder, it will be more of a manic type. And if it is depression, it will be very, very rare, at least due to ketamine. Maybe PCP may cause depression. So, in the same way, we are seeing mood disorder, anxiety disorder, and disorders due to the use of other specified psychoactive substances, episodes of so other. Now that's the category of other, 6C4E. So any other thing which hasn't been described, or before the ICD-12 comes in the next 10 to 20 years, if there are other things, they can be described here in the future. So other, and delirium by other. So other substances. And now obsessive compulsive disorder by other specified. So, so they are including everything here due to other. Then polysubstance misuse, which was F19. So if we go by F19 here, it was the multiple substances. Control F9 F19. So F10 to 19. F19, mental and behavioral disorders due to multiple drug use and use of other psychoactive substances. So multiple they used. Actually, they included, like they combined the two, multiple and other. So here they have said other, and now after saying other, they are saying poly substance misuse or multiple substance misuse. So disorders due to the use of multiple specified psychoactive substances. So wherever you come across the polysubstance misuse, you can go with the 6C4F category of polysubstance misuse. And again, dependence, intoxication, withdrawal, and multiple, so obsessive compulsive, and then disorders due to use of unknown or unspecified. So after the polysubstance misuse, they are coming with unspecified. And when we come to the uh, ICD-10, we were not seeing, we are seeing other, but we are not seeing unspecified. Because if we don't even know the name of the substance, what what can we, where can we put it? So it is the unspecified psychoactive substances. And here withdrawal in the same way as the other and all other drugs. Disorders due to use of non-psychoactive substances. Now, non-psychoactive substances. So that is a separate category. I think in ICD 10 wasn't very clear about it. And if if we have to describe, steroid induced psychosis or anything like that, I don't think it was very clear in ICD 10. Let's see the steroid. So yeah, it is here F55, abuse of non-dependence producing substances. So in ICD 10 it was there, but it was there not in F10s, not under the substance misuse category, because they were not dependence forming substances. So it was there as antidepressant abuse, laxative abuse, analgesics, antacids, vitamins, steroids or hormones, specific herbal or folk remedies, or other substances that do not produce dependence or unspecified. Now in ICD 11, they are going just at the end of the substance misuse chapter, they are producing as disorders due to use of non-psychoactive substances. So laxatives, growth hormone, erythropoietin, NSAIDs, and I don't know where they would put steroids, because steroids are somewhat psychoactive at times. So uh, let's search the term steroid in ICD 11. Corticosteroids, so under the schizophrenia they have described, and non-steroidal, so NSAIDs, and 6C4E. Here they are saying episodes of harmful. So here they are saying 6C4E. We're back to, so disorders due to the use of other. So they are putting corticosteroids and steroids in other now, because they are psychoactive. So when we go to the ICD 11, they just said non-dependence producing. Now they are not going with the dependence producing or not. They are saying whether it is psychoactive or not. So in other category, they are putting as steroids, anabolic steroids, and corticosteroids, and even HAT they have put here, although they have like metcathinone in the amphetamines, but HAT is they have put it here. So I don't know why they have put HAT here and not there, but anyway, this comes to in the other category. And now we come to the category of the unspecified, and after the unspecified, which is uh, not psychoactive, non psychoactive substances. So multiple unspecified psychoactive and and now we are here into unspecified, and we go back to the non psychoactive substances. So the examples they are giving here is NSAIDs, growth hormones, laxatives, erythropoietin, etc. And so they people do use them for from time to time. So harmful use, harmful pattern, and that's it, because they are not dependence producing, they are not uh, like and they're not at least causing the psychological dependence. So that's why they will put it as a harmful pattern. And then other specified due to specified disorders due to non psychoactive substances, disorders due to use of non psychoactive substances, unspecified, and thereon. Now, the other thing is addictive behaviors. And I think it was somewhere else when we go to the gambling. For example, gambling was described under the personality disorder umbrella or F60 umbrella. So, after the personality disorders, it came here as gambling. So, habit and impulse disorders, pathological gambling, fire setting, stealing, trichotillomania, and we discussed in last time, I think, that these things, some of these things are classified elsewhere now. So trichotillomania are the kind of bodily harm disorders or something like that, which are related to the body distress. So trichotillomania has gone there, and then there are other impulse control disorders. So here, welcome, Dr. Tariq. So, so here, what they are saying is this addictive behavior. This is the first time they are describing it here. That addictive behavior disorders. So, gambling disorder is the first one. And again, with the advance of technology and they are describing it as offline and online gambling. And now we'll come to the other categories, which will be online and offline as well, gaming disorders. And we really need to take care of our children and the next generation. Are they going to be kind of addict of gaming disorder, whether it's online or offline? We should really pay attention to that. So gaming disorder, predominantly online or predominantly offline. So offline, mainly if it is offline, you know, it will be kind of recurrent gaming, digital gaming, or video gaming, not primarily conducted over the internet, and it is manifested by this and this. So if it is offline, if it can be multiple users sitting together and playing on a computer, or if it is a board game, then just sitting together and playing. But usually it is a computerized. And if it is online, you are either playing it with an online computer server, or you are using you are playing with the strangers online whom you don't know. And if your children are doing that, that's really something to pay attention to. So gaming disorder, this is first time included. Now we come to the if we come here like a F63 trichotillomania, we said that it was described somewhere else, but fire setting, stealing. So let's see what are the impulse control disorders. So they come here now, and they are not under the F60 or personality category. They are just you know when we come to the here it was disorders due to addictive behaviors, block L2 to 6C5. So, so again, it is 6C5, 6C5, and this is a separate block now, because this is block L1 and 6C7 block, and impulse control disorders will come here now. Pyromania, kleptomania, both have come here. Compulsive sexual behavior disorder, that's a new category. Persistent pattern of failure to control intense, repetitive sexual impulsive or urges, resulting in repetitive sexual behavior. Symptoms may include repetitive sexual activities becoming a central focus of the person's life to the point of neglecting health. So that's another one. Intermittent explosive disorder, that's another thing. So I don't know if it was there in ICD 10 or not. Impulse control disorders were there, but explosive, no results. Yeah, here behavioral explosions. So yeah, it was there in the under the personality disorders, but it was described in the books, but not in ICD-10 as such. So in borderline or actually emotionally unstable personality disorder of impulsive type, there were behavioral explosions described, but here it is a separate category, intermittent explosive disorder. So what was in the books only has come to the classification now. And then it is the oppositional defiant disorder. Oppositional defiant disorder with chronic irritability, anger, and without chronic irritability, anger. So they are just oppositional but not angry. Conduct dissocial disorder. And another thing, I see the doubling here. So they will say here conduct dissocial disorder, but when we go to the personality disorders, they will describe it as a personality disorder as well. And again, they have excluded the childhood categories as to be childhood only. So any childhood category can be present in adulthood as well. And here is the example: childhood onset, conduct dissocial disorder, childhood onset. So adolescent onset. So they can continue in the adult life, and when they grow adult, you can see whether to describe them as something like adult like personality disorder or conduct disorder. So we have almost kind of almost 30 pages left. You want me to cover now, or do you want to cover all these next week, or some of them more for another 5 or 10 minutes?
Sir, please cover now.
Okay, that's fine. Yeah. So personality disorders, again, the personality disorder definition will be the same. So it could be mild personality. Now the only difference is they are saying mild, moderate, or severe personality disorder. That is one way of classifying the personality disorder, and it has made life easier for us clinicians. So if a very risky patient, we will diagnose it with severe personality disorder. Previously, this category was only available in the literature and in ancient literature, DSPD, dangerous severe personality disorder. So when a very, very high risk patient came, we are diagnosing her with borderline personality disorder. And a mild patient who comes for admission once a year for 3 days after a minor overdose, she was also emotionally unstable borderline personality disorder. One patient who doesn't come for hospital admission, she is also emotionally unstable borderline. But now you can go through, and you can categorize it mild, moderate, or severe. Now, that is one way of classification. The second classification, second system of classification of personality disorder is according to the personality traits or patterns. So here they are saying that the uh, predominant personality traits or patterns: negative affectivity in personality disorder, or personality difficulty. That's another thing which they are saying, personality difficulty. So they start with personality
Can you
difficulty.
please repeat that?
They start usually with personality difficulty, then they go with mild personality disorder, and then moderate personality disorder, and then severe personality disorder. And then they can say prominent personality traits or patterns. That is another way of classifying personality disorders, to describe the traits, what kind of traits are there. Negative affectivity is there, negative emotions are there. Detachment in personality disorder or personality difficulty. So relationship forming. And then dissociality in personality disorder or personality difficulty, disinhibition in personality disorder or personality difficulty. So they are going with dimensions rather than categories, that this dimensions, this axis is there or not. And then anancastia. So here we are seeing kind of emotional relationship patterns, and then the dissociality. So we saw above conduct dissocial disorder, and now we are seeing here as dissociality in personality disorder or personality difficulty. And then disinhibition in personality disorder or personality difficulty, and anancastic personality disorder. So that domain we are seeing in personality disorder. So we can see more than one domains. We don't have to call it like that this is this personality disorder. We can say it is a moderate personality disorder with the elements of some elements of dissociality, some elements of detachment, negative affectivity, dysthymic mood, or disinhibition, impulsivity, for example, here impulsivity, distractibility. So that's what it's saying in disinhibition, or anancastic traits, or borderline patterns. So it's a personality disorder with this and this trait plus borderline pattern.
So, what is negative affectivity?
Negative affectivity, I think it should be, I'm not sure, but it should be something like thoughts of ongoing low mood and thoughts of worthlessness. So we can read on that what they mean, but usually the feelings of emptiness, etc., in what we see in the borderline patterns. So they will come, maybe they are coming in negative affectivity, because there is we are not saying borderline personality disorder, but we're saying uh, like the personality disorder with negative affectivity or with borderline patterns. So let's read the negative affectivity. The core feature of negative affectivity trait domain is the tendency to experience a broad range of negative emotions, common manifestations of negative affectivity, not all of which may be present in a given individual at a given time, including experience experiencing a broad range of negative emotions with a frequency and intensity out of proportion to the situation, emotional lability, poor emotional regulation, negative attitudes, low self esteem, self low self confidence, mistrustfulness. So everything, negative mindedness in general, and that will I think include the feelings of emptiness as well in addition. And similarly, detachment. So the core feature is to maintain interpersonal distance, social detachment, because uh, they are mainly pointing towards the schizoid traits here. So emotional detachment, social detachment, avoidance of social interactions, lack of friendships, avoidance of intimacy, etc. Reserve, aloofness. So here we are seeing negative affectivity. We are seeing more of a paranoid picture plus the negative affectivity related to borderline personality disorder. So paranoid personality disorder is not a term here, but we are seeing the negative affectivity, which could be in a mistrustfulness dimension, or it could be low self-esteem, as we see in borderline personality disorder. Then detachment, it is something like schizoid. Dissociality, it's self-explainable that it is something like the dissocial personality disorder. But let's see if there is anything else. So both self-centeredness and lack of empathy, common manifestations of dissociality, uh, not all of which may be present. Self-centeredness, self sense of entitlement, expectation of others, admiration, positive or negative attention seeking behaviors. So they are including the narcissistic traits and histrionic traits here, positive and negative attention seeking behaviors in dissociality here. Desires and comforts, lack of empathy, manipulative, deceptive, exploitative of others, mean, physically aggressive, callousness. But when we go above, so let's say 178 page we are in when we come back. So if we go to the dissocial conduct dissocial disorder, here it will be more dissocial or more antisocial. So repetitive or persistent pattern of behavior in which the basic rights of other and major age appropriate societal norms, rules and laws are violated, aggression towards people and animals, destruction of property, deceitfulness, serious violation of rules, etc. etc. So, dissocial personality disorder will come under conduct dissocial disorder, and some of these features will come under under the dissociality in personality disorder as well. But uh, narcissistic and histrionic personality traits will come also under the umbrella of dissociality, and here they are more describing actually those more histrionic and narcissistic personality traits. So if we go by one of the bookish classifications, which is totally bookish, and it's not, it's just a way to remember, mad, bad, and sad. So mad, paranoid, schizoid, bad when we come to, so it's the like the antisocial, narcissistic, histrionic, and borderline, and then sad are the negative affectivities like obsessive compulsive disorders, obsessive compulsive personality disorder. So so here we are seeing more of a personality disorder and difficulty here in the dissociality, which is including histrionic and the narcissistic traits. Disinhibition in personality disorder or personality difficulties. So again, impulsive part has gone here. So emotionally unstable personality of impulsive type, it has gone here in this dimension. They are describing these. Now in the anxious anxiety, uh, so like the avoidant and dependent we will see, but anancastia is here now. So anancastia in personality disorder and our personality difficulty. And I guess why they're describing dimensions than anything, because when we say borderline personality disorder, we just presume that this is borderline and it has nothing else. in addition. And similarly, if we are saying antisocial, we just forget the elements of other. So now they are saying personality disorder with this and this dimension. If there is only borderline dimension, you will just say mild disorder, mild personality disorder of borderline pattern, or impulsive pattern, or whatever patterns are there, you can add on. So the avoidant and dependent, I am not sure where will they go. Maybe in the negative affectivity to some extent, but I am not sure. Uh, so I can only search the avoidant and dependent. So avoidance, mm, or is it avoidance and yeah. So I don't know. They haven't included it here. But if at all, if we have to describe it, we will just go through to the personality disorder and see like where it fits, whether it fits in borderline or in anancastia, etc. So anancastia, perfectionism, hyperscheduling, stubbornness. So it's all to do with the anancastic personality disorder, and emotional and behavioral constraints, rigid control over emotional expressions, stubbornness or and inflexibility, risk avoidance, perseveration, and deliberativeness. So we can see the term avoidance here, and let's see if dependent is there or not. And of course, we'll see dependence in the substance misuse a lot. So dependence, and it's very difficult to differentiate. But here, when we see it here, uh, dependence, and so again it will, when it comes with the relationship, and we can describe dependence as a domain somewhere. So let's go back to the personality disorder here, and we seldom diagnose the avoidant and dependent personality disorders anyway. So if we have to kind of put anything in dependence, we can use any of these categories. For example, negative affectivity, or for example, detachment, or anything which will fit with the dependence, dependent relationships, or even with avoidance or ankestia, we can use. Paraphilic disorders. So again, there were many paraphilic disorders which were, I think, described as other, point 0.8 something. So they have included most of them here. Exhibitionism, voyeurism is now voyeuristic disorder, pedophilic disorder, coercive sexual sadism disorder, frotteuristic disorder, you can read on that, and other paraphilic disorders. Paraphilic disorders involving solitary behavior. So the first one, it is like the, if we go, so this is exhibitionistic disorder, and then the next category is non-consenting individuals. Paraphilic disorders involving solitary behavior or consenting individuals. So here it was non-consentive, consenting, and here it is consenting or solitary behavior. This is just like another category, and then there is an unspecified category. So what they have excluded it, I think they have excluded the sadomasochism, or like if they have to describe, you can describe it here, or fetishism. These categories are, I think, now excluded. Now, factitious disorder imposed on self. So what was Munchausen syndrome and Munchausen by proxy? It is now factitious disorder imposed on self, or factitious disorder imposed on others. Neurocognitive disorders. So we have kind of 20, about 25 pages left. And we'll continue with the neurocognitive disorders, inshallah, next time.
Sir, is factitious present in ICD-10? I can't remember at the time.
I think it was there, and there was a term as Munchausen as well. So
Mm-hmm.
if we Munch, not coming up in ICD actually, but factitious factitious disorder here. So F68 under the personality disorders, it was there as a persistent of a pattern of intentional production. And if we go to, I think, ICD-10, like the blue book, it may say it includes Munchausen. But
Mm-hmm.
here it is a factitious disorder imposed on self or imposed on another. And so
Right,
inclusions
sir.
are
Thank you.
Munchausen syndrome even here.
Mm-hmm.
Okay. So yeah, so we'll go with the delirium next time, and mild neurocognitive disorder, which is mild dementia, or actually mild cognitive impairment, not dementia, amnesia. So we'll go through these old age categories next week, inshallah. Until then, Allah Hafiz. And any questions?
Yes, sir. Thank you very much.